Good afternoon and welcome to today's episode of Ashgrove TV. Today I'm having a wonderful conversation with one of the physios at Ashgrove Clinic, Kerry, and Kerry's going to be talking to us all about TMJ and how that relates to neck and jaw pain. So if you have any questions relating to that you'd like Kerry to answer today, feel free to send them in, and hopefully Kerry's going to share some insightful knowledge that will help you out. So Kerry, welcome to the episode and thank you for joining us today.
Thank you for having me.
I'm really interested to speak to you today about neck and jaw pain. Something I've encountered both personally and with clients over the years. So it'd be really interesting to speak to you to see kind of what it is and also how people can either help themselves or how seeing someone, a professional like yourself, can help. So firstly, what is TMJ?
Okay, TMJ is the jaw joints.
Okay.
There's one on either side, and it's basically the joint that enables you to open your mouth.
Okay.
Move it side to side, so any chewing, it's and they're two, but they are linked. They work together.
Okay. So if that's not working quite properly or functioning correctly, what kind of problems could that be presenting to somebody?
So someone would have facial pain,
Yep.
headaches, migraines. That's one of the first signs and symptoms is the headaches and the migraines. Tooth pain, so they might end up going to the dentist and have a tooth out and all the rest, and not need to, because it's actually the TMJ that's causing that. Clicking, popping, clenching, grinding.
Yeah, that's the one I was going to ask you about. So is there any way of somebody being able to either self-identify whether there's a problem with the joint, or is it something that someone like you would need to kind of help them to work out? Or is it if one of those symptoms are present, then that's likely to be the case?
Yeah. I mean, you don't have to have all the symptoms.
No.
You could have just one or two.
I just didn't know if there was any way of kind of that you'd feel it or know it in yourself, or is it just if there's one of those symptoms?
It's
complex.
Yes,
Yeah,
it is.
Not straight answer.
It is.
Okay.
Someone would be, generally they'd be in pain most of the time.
Yeah.
Or not be able to open their mouth, or but pain meaning headache maybe as well, and it could be all neck pain.
Yeah.
And then they'd want to see someone.
Yeah.
And then, as I said, they might go to the dentist first, or the GP, or, from person to person, and not get the help that they need and the management that they need.
So so if there's persistent kind of symptoms or problems and they're not getting the answers, it might be a good idea to kind of look at that joint and see if that relieves.
That's where the physio comes in.
Brilliant.
So they would see me, and there aren't many TMJ physios.
It's quite a specialist thing, isn't it?
It's quite a specialised area, because it is so complex and
I guess the reason I was curious is because as a hypnotherapist, I work with a lot of people who struggle with stress and anxiety. And I've always, and I can't remember where I got it from, but I always remember somebody saying that a lot of tension starts in the jaw. So when I take people through a kind of a guided progressive relaxation, I always put focus on relaxing the jaw.
Yes.
And, people often think about neck and head and shoulder tension as being where it starts, but it really starts in the jaw, doesn't it?
It starts in the jaw. That's correct. And if you have it in the neck, it's going to overflow into the jaw.
Yeah. So are there any exercises that somebody could do to help prevent or to help relax that area?
Okay, so
any simple, easy ones?
With the jaw, less is more.
Okay.
So rather don't do than do. Don't go and look up all these strengthening exercises and all the rest.
Keep it simple.
Keep it simple. And the best thing to do is actually to become mindful. So remind yourself, set reminders, say every hour or every 2 hours if you're really busy, and then take note of how
it feels.
Your muscles feel. Is there tension? Are your teeth together or apart? Because they should be apart in the resting position. And then what you can do, a simple exercise, is to put your tongue on your top palate. So if you put your tongue there, you can't close and bite down, and then you just deep breath in and out 3 times every hour.
So for my clients, we've been doing it right for all these years. So we had an expert tell us we're doing it right. So that's brilliant.
Good.
Yeah, it's really good. No, it's good. And the other one, I was talking to somebody earlier when I said I was doing this, and they talked about the kind of teeth grinding.
Yes.
So is that another common problem that comes from that joint being?
Yes, it is. Yes, it is, definitely. And a lot of people grind their teeth and don't know about it. So your dentist will usually tell you that your teeth are worn down.
Yes.
But even not necessarily only grinding, but clenching. Or just holding it there. Some people do it during the day, some people do it at night.
So that exercise that you mentioned then, that's a really good preventative, that during the day, just people check in, relax the muscles around the area, place the tongue at the roof of the mouth, take a few deep breaths, and just learn to relax the muscles around that area. You consciously trying to change the memory pattern and the movement pattern of everything in your face and jaw. Which I think a great thing to do preventively anyway. I think people don't realise how much tension they're holding often. But if somebody's having one of the kind of persistent problems that you've mentioned, I think people always want to know, how easy is it to fix or help with? Is it painful? So talk us through, if someone was to come to you today presenting one of those things, how straightforward, how effectively could you diagnose and help them to relieve that?
Okay, so it is a process. It's not going to happen overnight, especially if it's been there for quite some time. And with most people, it has been there for longer than they are aware of. So it would be hands-on treatment. Of the neck as well. Okay. So neck and jaw. And then if the neck is painful, I always treat the jaw as well. Okay. So hands-on treatment, and then it would be me teaching you self-management techniques. So, giving you tips and tricks to do exercises or...
And are they quite specific to the individual, those exercises, or are there some generic ones that you've already shared a really good one? But let's focus, because I think neck pain is another common one.
Yes.
So if somebody was struggling with neck pain, are there any self-management? Is there one kind of tip or strategy you would give someone to practice preventatively?
Okay, so the neck and the shoulders, you want to relax as well. So a brilliant thing to do is every hour, along with your breathing, you're just gonna
roll them.
Roll backwards, never roll forwards.
Okay, so open it up.
Because we always sit in, everything's getting tighter. We want to go backwards and not, not stressing it.
Just a gentle roll.
Just relax. 1, 2, 3.
Okay, so we've got the jaw, relax the jaw, roll the shoulders. Is there another common one or problem that we could help people with if they had another exercise that you could share with them today?
Another exercise is just gentle nodding of the head.
Okay.
that would also be intermittently throughout the day.
Yeah.
Yeah.
Just take time periodically.
but never backwards, because you don't want to go and compress those joints at the back of the neck.
So forwards.
So forward
neck,
and
forwards.
up to the middle.
So shoulders is back,
Yeah.
neck is forwards.
Neck is forwards. Yeah. So I know people are time pressed and busy. So what you could do is you could alternate each exercise. So say at 9 o'clock in the morning, you 1, 2, 3, and just 3 repetitions because you're doing it often.
Yeah.
And then 10 o'clock comes and you're going to do the neck. And then 11 o'clock comes and you do the breathing.
Great tip.
And then carry on like that.
However,
yes,
they're quite quick, easy techniques, aren't they? So if someone was to do one of those, how long would it take them to do?
What do you mean?
So the roll in the shoulders, how many repetitions of that?
Just 3.
So it's not...
Three because you're doing it often.
Sure. And the neck roll the same?
Yeah.
So the jaw is 3 breaths.
3
It's all
breaths.
3?
3.
So although you're giving people the excuse not to do it regularly,
Yes.
there's no reason why they couldn't combine all 3 together.
Of course.
Multiple times throughout the day.
Of course. If you've got the time, I think that's brilliant.
Okay.
Yeah.
Have you noticed any other factors of life that have impacted the jaw and the neck problem? Is it the use of mobile phones or hunched over computers? What are some of the common lifestyle things that are impacting it? Okay,
so we'll talk about the neck relating to the jaw. Your head is basically the weight of a bowling ball.
Okay.
And then the neck is the pole that it sits on.
Right.
So, and then your jaw, your bottom part of your jaw, hangs on that. So if you take that and we are, for example, sitting hunched forward or on our phones, it's gonna push that neck forward and the jaw goes into a funny position as well.
Okay.
And then you might, as a response to that, you might then start clenching or trying to tense, trying to get it back into the correct position.
So again, use some of your exercises, or if it's persistent.
And also the sitting.
Yeah.
But with regards to sitting, because people spend most of their days sitting nowadays, and your muscles only have enough energy in them to keep you in a nice, good, upright posture for 20 to 30 minutes.
Okay.
After that, energy is depleted, and you start slouching, you start shifting around in your chair. So what you want to do is
move.
Every half an hour, just break the posture.
Good idea.
So it just means just stand up, and then 1 or 2 or 3 seconds, and then sit down again, and you're good to go for the next half an hour.
Perfect. I think we've got some questions, so let's have a look at what we've got. I think we touched on this slightly, but Laura asked, how do you test TMJ? Did you say that everyone's different, so it's hard, or?
Everyone's different, but I would look at the teeth to see grinding, or to see if the person is grinding, and then basically look at all the movements. The jaw is lovely when there is a dysfunction. The one side's not going to work with the other side, so you'll actually see it in the jaw movements. For example, a lot of people, if they open their mouth, when they close, their teeth, if you look at the teeth, end up doing a bit of a zigzag, and that's because it just doesn't work nicely together.
Not aligned.
Does that make sense?
Yeah, it does.
Yeah.
Sarah's asked, is jaw clicking bad?
Is jaw clicking bad? Jaw clicking, if there's no pain, it's generally not a problem. But if it's associated with pain, then definitely seek help.
Okay.
Yeah.
And Pete, does stress make TMJ worse?
Yes, definitely. Definitely. We're going to tense our muscles, we're going to, bite down on our jaw or clench our jaw without even realizing it. And yeah, it does definitely.
Okay, so doing the things that you've suggested will all help?
Yes.
Great.
Yes.
Kath, when should I get my jaw checked? Does it have to be in pain, or can we get a click and jaw checked if we're just worried?
Of course, because the clicking actually has to do with the disc, which is like a jelly-like substance, which sits in the joint, and the clicking is often where that disc is just not moving with the bones, not moving properly. So I would be able to tell whether it is a problem and it has the potential to become a problem.
So basically, definitely get it checked if you're worried.
Yeah, definitely.
Okay. Another question, I'm not sure who's asked this one, it's anonymous, but for the last 3 months or so, I've been noticing my jaw is clenched almost all of the time. I've never had this before. What's wrong with me? How would you answer that one?
Well, there are a whole lot of factors to look at there. It is anatomically, or the body you need to look at. You need to look at the neck and the jaw, and is it all functioning properly together? And then also stress, stress and
Just your posture and the way you're carrying yourself can impact it.
Yes, your posture. And
so it's kind of, for me, when I had an issue, I had 2 car accidents in quite a short period of time. So I got whiplash in both.
Okay.
And Claire at the clinic helped with that because the jaw was really clenching and there was some teeth grinding going on. So it could be something that's triggered it.
Of course.
But it could also be a build-up of factors of stress.
Build-up of lifestyle factors as well, yes.
So it's not exclusive to, a trigger or...
No, it doesn't. Something doesn't have to happen.
No.
It can either be triggered by an injury, or it could just develop over a period of time because of something else not working properly. So say your posture is off, eventually your jaw is going to become a problem.
So to answer Kath, I think it was Kath who asked the question. No, it wasn't. It was the anonymous. They said, "What's wrong with me?" Well, it might be that it's not something you've done. It's just a build-up, an accumulation of things that have kind of led them to that point where they're now clenching their jaw.
Yes.
Yeah.
Yes.
So don't worry. Just get it seen to.
Yeah. Don't. It's nothing.
Yeah.
Yeah.
Okay.
It's easily treated and easily managed if you see the right person.
Yeah. Okay. We've got some more questions coming through, so let's see how many we can get through today. Laura, can we see if Christian's jaw moves normally? As a hypnotherapist, he must talk all the time. True. Does that make a difference? So, do you notice people's professions having an impact, or not really?
Yes. But more so, so yes, okay, overuse of the jaw.
Yeah.
But that wouldn't. That it would normally be things. If things are going to make a difference, it's going to normally be things like chewing a lot, chewing gum a lot.
Right.
Those types of habits are where you overusing that jaw.
With you.
So chewing gum. Or chewy things, chewy sweets.
Yeah.
Often, but then, with regards to your occupation, if that's going to make a difference, then it's going to be more your posture that throws things off.
Okay.
Yeah. but let's have a look.
What do you want me to do?
Sorry.
How do you want me to?
Okay, so firstly, I'd ask you to just open your mouth and close. Okay, open slowly. And close slowly. Okay, that looks all right. And then you're gonna just let your jaw hang, and then you're gonna go more side to side. It looks.
It's okay. Good. We're all
looks
good.
Okay.
But it's if someone was to come and see you, it's simple things like that. You'll just be looking and assessing the movement.
Yeah,
and
movement.
the mechanics of
movement, but then movement of the head as well, the neck as well.
Okay.
Looking at posture, often you can see
Sort of an imbalance.
you can see, the person looks off.
Okay.
The average person wouldn't be able to see it.
No,
but
you're trained eye.
I'm trained to look at that. And then I'd feel.
Okay.
Feel the muscles, that's very important. Feel tension in all the muscles around the face and then around, because when you bite down or clench, then these muscles are working as well.
Right.
Yeah.
So you'd be feeling to check.
So that's how the jaw would affect the neck.
And then does that then sometimes where some of the headaches can come from?
Definitely.
Yeah.
Headaches are, if you get in a neck and jaw headache,
Yes.
it does normally come from the first two levels of the neck.
Okay.
So it's that little area, and then also just tightness and like a knot, what I would call a trigger point in these muscles can also cause headaches.
Okay.
Yeah.
And other than the 3 exercises you've already shared, are there any that people could do if they're either prone to getting these headaches, or if they're feeling one, or they've got one? Is there anything they can do to help kind of alleviate that?
Okay, so specifically for the jaw and the face, you want to do a relaxation exercise. Okay. So a good thing to do would be to actually blow out. So you're gonna go and then relax.
Okay.
But in a good posture.
Yeah. And that can help.
So tensing the muscles, holding it there, and then releasing. Just relaxes it nicely.
So what's that one doing? What's that exercise doing?
It's, once again, relaxation.
Yep.
Yeah, and getting that jaw open.
Okay.
Not open wide.
No, it's
just teeth apart.
Okay. So if someone is having a headache or feeling one coming, that could be a useful thing to do.
Could be.
Yeah. Any others?
So if you're having a headache, it's not specifically jaw, it's more neck. But a good thing to do would be to take this part of your thumb and you're gonna put it just below the actual skull, so you can try. And then you're gonna basically pull up with the thumbs.
Okay, so pull up.
Yeah, so you stretch in that area.
Gotcha.
And then also the jaw will go into a good position.
Yeah. So simple
when
again.
you do that. Simple. So you're not trying to move, you're just trying to actually stretch the area.
Okay.
Yeah.
So, Laura's asked a question. Is treatment painful? Or does that depend on how they're feeling and how much pain they've got to begin with?
Yeah, it all depends. I mean, I don't hurt people.
No.
It's not a case of no pain, no gain.
No, okay.
If you really, really, really sore, I'm going to obviously go a bit easy on you. Not put too much pressure, and It's all graded according to how you are feeling. You might have post-treatment tenderness, but that shouldn't be too bad if I've done it correctly. You know, if I've over-treated, then you might feel very sore the next day. But generally, you might have a bit of post-treatment tenderness. You feel like you've been worked on, but then once that eases, you feel a lot of relief.
So as a golden rule, it's not painful, but there may be some discomfort, but it sounds like it's almost a positive that it's something's being worked on.
And I find generally my patients say it's a good pain.
Okay, because there's progress.
It feels like you're working on the right area.
Okay. So Laura's asked another follow-up question to that. Thanks, Laura. How long does it take to fix TMJ problems?
That all depends on...
$1 million question, eh?
Yeah, that all depends.
Some guidance? What sort of guidance would you give somebody?
What do you mean, on how long?
Yeah.
So, as I said, it's a process, and we work together, and you normally, with jaws, it's quite a lengthy process, but not lengthy in terms of you're going to have to wait so long until you have relief. It's lengthy in terms of you've got to carry on managing it.
Gotcha.
Otherwise, it will come back. So, you know, I normally see people for 6 to 8 treatment sessions, and then possibly maintenance after that, once a month. You come in for your MOT.
But with most things, it's dependent on how much they put into themselves and how much they do in between the sessions.
Yes,
really,
how compliant they are.
We're very nearly running out of time, but Pete's just asked another question. If I'm still stressed, can I still get better? And then he's asked, do the two of us work together to help with the stress and the TMJ? Well, I'll let you answer the first bit then. If I'm still stressed, can I get better?
Yes, of course. Of course. There's no reason why you need to be stressed and carry on being stressed. But the stress, the mind, affects the body, and the body affects the mind.
100%.
So yes, we do work together. That's the second part.
And I think that's what's great about the clinic, that there's so many different kind of modalities and disciplines available. That, you know, there's often a huge overlap that can be done to help people from different perspectives. So we can cross-refer, can't we?
If I feel that you need another practitioner,
slightly different approach.
Then I will refer, and I often work together with an osteopath.
Cool.
We just see you at different times and then communicate if it's okay with you.
But it can be really effective, can't it, to do that?
Definitely.
Well,
and dentist if needs be.
Before we kind of close, is there anything that you want to share or to kind of leave the viewers with to help them? Any parting kind of summary?
Move often. Try and get that jaw relaxed, and if you are struggling with anything, then come and see me. or go and see a specialist physio, I would recommend. Just
reach out, ask the question, and somebody will be able to kind of guide them in the right direction.
Yeah, definitely.
Kerry, it's been a fun time having a chat with you. I'm sure Kerry shares some really useful, insightful tips, techniques and strategies that you can use yourself. But as Kerry just said, if you are struggling, if you need any help, then don't hesitate to contact the clinic. The next episode of the Ashgrove TV will be on the 3rd of March, so look out and tune out for that. And if you're new to the clinic, there's a speech therapist starting, and we've got some weight loss classes, so if there's anything you need help with, then please don't hesitate to contact us. Until next time, we'll see you soon.